patients who have underlying heart disease or any underlying condition are not necessarily at higher risk of contracting the virus, but they are at higher risk of having more severe symptoms from the virus and having complications from the virus. So that's why anyone who has particularly underlying cardiovascular disease, whether that be high blood pressure, prior heart attack, heart failure, should be very cautious about their risk of contracting the virus. It is very important for heart patients to continue to take all of their medications as prescribed during this time, as keeping your heart healthy is very important to keep you healthy. So before making any medication changes, you would want to talk to your cardiologist about the medications you're on if you have any concerns, but please do not stop any of your medications without talking to your healthcare provider first. If you have an appointment that is for regular follow-up, that's just, again, a regularly scheduled visit that you do every 6 months, every year, you can discuss that with your provider, as we are starting to do virtual visits. So you can, if you have no symptoms and you're feeling otherwise well, can set up a virtual visit with your provider. However, if you're having symptoms that are new or worsening, then you do want to go in and see your provider in person. If you are experiencing symptoms that are concerning for a heart attack, including chest tightness, feeling like an elephant is sitting on your chest, shortness of breath, feeling hot and sweaty all over, nausea, then you definitely should come to the emergency department and be evaluated. The risk of contracting coronavirus, of course, is going to be much lower than the benefit of being checked out if you are having a heart attack. Heart disease does not take a break during the pandemic. People will still continue to have heart attacks, heart failure, exacerbation. So if you are experiencing any of those symptoms, please do not hesitate to call 911 and come to the emergency department. You should stay as active as you are able to be while appropriately social distancing. So if the weather is nice out, go for a walk. Just make sure that you are maintaining at least 6 feet from other people. But of course, maintain your activity level. It will help not only your physical, but also your mental health during this stressful time. There are wonderful resources for patients available on the internet. One of the best resources is from the American College of Cardiology, or the ACC. You can just Google the ACC and you'll be taken to their website, which has COVID-19 updates directly on the front page. If you have any questions at all during this difficult time about your heart health and heart disease, please reach out to your cardiologist at any point.